All right, we are on day two of the injuries. Justin's arm here is all scraped up. His hand is hurting and also his foot. We all had so much adrenaline in our system last night. It's like, it was crazy. And that's once I was at the ER for a while, I realized that my arm was hurt. Got whacked pretty good right there. And so, I'm gonna get an update from Jason because he's got a lot going on with him.
There you go.
So where do you feel that it's messed up?
Oh, right there. That's
Right
where
there.
this fracture is.
All right, so here's Jason's crooked nose. So,
Yeah, I have to come back, and they're going to put me under, and they're going to pop my nose back into place. It sounds so bad. He's like, no, we put you under. We tried doing it to people that were awake, and it doesn't work well.
So you're gonna have that procedure done, and they'll try to fix your nose. He says you can feel clearly where it's broken.
Oh yeah, he's like, oh, it's right there.
And then it's gonna heal up, and then you probably have to come back for another procedure after that. So
Yeah.
this is long.
I'll be in the ENT for a while. Ear, Nose, and Throat Institute, Tennessee.
It's a long process, all because of some guy that didn't want you to video a public park. It's ridiculous.
Yeah, just because the guy wanted to try to interrupt our filming a public horse show at a public park. I did not see him climbing up the ladders to attack all the big cameras up in the grandstands, like the camera spot. So, yeah, it's the way it is, and deal with it, and keep going, one day at a time.
This is round 3
for them.
pig catching.
Round 1 for me.
Well, Haley's not here today, so we have Keith on his birthday to catch pigs. So
We'll
I said,
see.
happy birthday, Keith. You get to
Yeah.
go get some hogs.
There you go. So I get to go see if I can wrangle pigs like I used to when I was younger. Yeah.
So the lady caught the other two, huh?
She caught the other 2, and we're going to try it again. We're going to have a better setup this time. Keith's probably going to lay under the trailer so that
We'll see.
So if they run by, I just reach out and grab them. I know you.
I would have been excited. He was like, is Keith going to be coming? And I was like, I have no idea.
Yeah, they sent the girls yesterday.
Yeah.
The girls aren't here today, so
Right.
they're picking the old man to come. So.
Get to bring them pigs.
Well, today's his birthday, and I said, happy birthday, let's go get pigs.
Yeah, happy birthday! You're going to us get pigs. So, yeah.
This part.
I'm gonna get some cinder blocks to block this off so they don't go underneath the trailer.
I'm checking for spiders. I don't like spiders.
Me neither.
Yesterday, they went through, like, here.
You're on that pallet. There. There you go.
That was a lot easier.
Oh, we did it, Keith.
Thank you guys.
Thank you for calling.
That was decent.
Yeah, Doug came in there this morning, woke me up, and he was like, going to work, and I was like, don't feed the pigs, I gotta put them up. And he was like, I already got them. And I was like, you are amazing, thank you.
This is just, this week, my week's completed. My whole task. We got the pigs, all of them this time. There was no running through the woods, but you know, she was set up for one. But we're gonna take them back to the shelter and see what Lynn thinks about them.
Yeah, back up to the barn. Made it back. We got the piggies. We'll see how unloading goes.
Release the babies.
Got all the piggies.
All right, good morning, Tony. So I hear we have someone very special coming in.
We do, we do. She actually arrived last night. It's one of our donors that has helped us tremendously here at our facility, especially building infrastructure to help more horses. So she's coming here, she's gonna have a tour, she's gonna hang out for a few days. We're gonna have an awesome time, but we're just so incredibly grateful for all of her support because we wouldn't have a quarantine facility like we do without her. You know, the donations that come in to help, you know, rescue horses and everything, that's wonderful and it's so needed. But there's a lot of facility needs as well, and she's just been a champion in helping us with that. So shelters in quarantine, panels in quarantine, you know, she's the new intake facility in quarantine. She's been a huge supporter of helping make all of this possible for the animals here at our shelter. So we're super excited she's coming today.
So our local animal control just came by and they dropped off about 4 kittens. They're super cute, very young. He found these kittens in a McDonald's dumpster it was called in from, and they think that the mom might have died, a car might have hit her. And these kittens were rescued by him, and he knew to bring them into Horse Plus so that we can find them a good home and just take care of them. It's really been really hot today, so they were overheating, and we're just really grateful for him that he was able to, first of all, for the McDonald's employees to call it in and get them rescued, and for him to be putting them in some air conditioning. Definitely some interesting names out here. Was it Spicy Chicken Nugget, McLovin, you know, some good ones, of course. We're just very happy that, you know, everyone here is working together to make sure that these animals stay safe and happy.
With that discharge that we're seeing, there's probably still something in there. Okay. There might have been like a little pocket that Lydia couldn't get to, but at this point, we probably shouldn't be seeing that much discharge, so it's still a little abnormal. So the cold hosing, which is what you're doing, you use cold water. It obviously helps clean the wound, and then it also momentarily will reduce the blood flow to that area, which can help decrease the swelling and inflammation. So we'd like to put her out in a pasture, but with where this is and everything, and the fact there's still like a draining wound, if she goes out and starts rolling around and gets a bunch of dirt in it, yeah, kind of like goes against what we're trying to promote. So that's why moving her to that big stall again, we'll be able to open up so she has access to at least like that little pasture so she can still go out. She's also a little tricky to catch because she's a Mustang and she knows it. So she knows how to bribe you for the snacks first.
So who is this, Mahogany?
This is Mahogany.
Hi, honey. Get the bath.
Yeah.
You liking it?
We're doing some cold hosing on her wound.
Cold hosing?
Mm-hmm.
So what is this, hay from rolling?
Yeah, she's in a fresh, clean stall. We moved her down to a bigger stall for the weekend. So she had a bunch of fresh shavings and everything. So
when did she come in?
She came in with our last buyout in May. She came in with her baby. Unfortunately, her baby did not make it. They both had penetrating wounds. That's what we're hosing right now to try and get it to clean up because it still has some discharge coming out. But
there you go.
Good girl.
You like that?
She's like, that's big.
Wow. Yes, she's loving it.
Last Thursday, Dr. Lydia opened up that wound and kind of cleaned it out. She was worried there was still a foreign object in there because it was about this this long into her chest. So she opened it, got a bunch of junk out of it. It could be from the environment, depending on where they are, running around and just running into something wrong, rolling on something sharp. Yeah.
Funny.
So we get her in daily right now to keep an eye on it.
Is that pretty normal for the animals that we had in vet barn? Like that were
in the vet barn, we do daily. Yep. So if they're in the vet barn, it is because they need daily checks.
There you go.
You think it's like worth trying to flush it? Just with like some sterile saline or something?
I mean, you can try getting like the small one and putting like an 18 gauge, the opposite, and like squirting.
Yeah.
We can try it, but.
So what are we applying here, Nicole?
So this is just some, I mean, what is it considered? Phyllite. Multiple electrolytes.
It's a hypertonic saline.
Yeah, it's just some saline with electrolytes in it. But we're just using it to flush out her wound because she has had a lot of discharge still coming out of it. And the hose does a great job, but sometimes having a nice little high pressured stream works pretty good.
You're being a good girl.
So she still has like a little tract in here. I know, sweetie. So I'm just pushing it. So I'm kind of just like flushing it out, and then this wound went way up in, and there's still a little pocket.
You're still tender.
Oh, that looks better. So we got most of that out of there then. It's one of my biggest pet peeves, which I think was it you the other day I mentioned it too about the topicals?
Yeah.
Is people have super dirty hands, or like I used the E3 wound ointment first, and then you just stick your hand in here and contaminate this with all sorts of gunk, and I hate it. So that's why like I'm sitting here using different fingers for everything. There you go.
Awesome. Good job, ma'am.
Do you want to walk her back out, Hallie? I can open this for you. She can be a smidgen pushy, but if you're just kind of like push back on her, then she's like, oh, okay. Good girl.
That was it, ma'am.
When he starts talking,
All right, so y'all just saw Corey. Corey was, as you know, our trainer for 3 years. Maybe you don't know because you're new to our show, but Corey was our head horse trainer for 3 years, and he did an absolutely amazing job with the horses here. But he left to pursue a job in construction, and construction pays quite a bit better than horse training, unfortunately, and we just couldn't match the wages, but he is doing really well. But Corey just brought back James. It's a horse he adopted a while ago, and James has had some behavioral issues with the saddle. And Corey was, unfortunately, I don't want to go too much, but he was in a really bad wreck, and he can't ride a horse that could possibly throw him. So he, at this point in his life, he's not able to give James the training that he needed. So he brought him back, and our vets are going to reevaluate the horse because when he was adopted from us, obviously they'd done the full everything on him. But they're going to check him out again, see if maybe there's something medical to why he's starting to spook and buck. So anyway, it was good to see Corey again. Always good times when he's around. So we'll see him again soon, I'm sure, for one reason or another.
You just get a quick baseline heart rate. So Dr. Gina and I wanted to update all of you guys on this handsome gentleman. His show name was Tar Heels Irresistible, and our supporters named him Footloose. He was a big look show horse. He's 19 years old, and we intercepted him from a slaughter auction through our buyout program this past month. And has a lot of medical concerns. We've done a lot of things with him. So if you guys have been watching our videos, some of this will be repeat and some of it is new information. Dr. Gina did a lot of stuff yesterday, and she and I work kind of different schedules. So we're just gonna kind of go through and summarize our findings and our concerns and kind of where we are now. He's such a good boy. He's been an absolute gentleman. So he came in pretty obvious discomfort. He has these very large shoes on that are called stacks. These shoes are designed to exaggerate what they call the big lick stride. And in full disclosure, I am not a Tennessee walking horse person. I know very little about this industry, but his angles of his feet are quite higher than normal. And so right away, the most obvious thing that you notice with this horse is that he trips a lot in his front end. He has a really difficult time walking with these shoes on, and that all of the rest of his body has been compensating for these shoes. So he holds his hind legs really far underneath him, and kind of his whole body is at a weird spot. And he's got discomfort kind of from his cervical spine down, and you can kind of see some of those spots. So on intake day, we just kind of triaged him. We started him on some pain medication right away. We took some x-rays of his kind of like head, neck, and back. And the most notable abnormality that day was that he has very pronounced kissing spine. Kissing spine is when the upper parts of the vertebrae of the spine that should be parallel to each other are actually touching each other. And in his case, he has between 4 and 6 vertebrae affected and some really extensive arthritic lesions. And we can show you guys that radiograph if you want to see it. So he has evidence of discomfort kind of in his lower back, which makes sense if you look at the way he moves, because he's kind of camped out underneath. So he's got some pretty obvious back discomfort. We weren't able to do a lot of diagnostics on his legs because on intake day, I guessed and gave him just a little bit of sedation. We didn't know this horse at that time. We had 20-something horses coming in one day. And so I employ sedation to keep everybody safe. And I over-sedated him, even though I gave him just a little teeny tiny bit. He was very, very sedated and wasn't able to stand safely, and our staff wasn't able to safely do those. So we just put him in a heavily bedded stall and let him kind of sleep that off. And since that time, we haven't had to sedate him a single time because he's been lovely and he's been trained not to move his feet. So since that time, we brought him right down into our veterinary hospital. So he's been in a stall. Unfortunately, he can't be turned out because he still has these stack shoes on. And also, unfortunately, I didn't feel comfortable recommending that we take those shoes off because we believe that he has been in them for a very long time. We don't know for sure about this horse, but other horses in this industry start showing around 2 years of age with these shoes on, and he's 19 and had a very long show career. So it's safe to assume that he's been in these shoes for a very long time. And we were concerned about abruptly changing the angle of his tendons and ligaments in those legs without consulting with our farrier and making sure everything was good there. Dr. Gina did perform ultrasounds of his tendons and ligaments, and we did some studies with our thermal imaging camera, and we didn't see anything super off in the front legs. So that's great. That's the first thing we have to determine before we talk about taking those shoes off. But that doesn't mean that we couldn't suddenly change strain in that leg and cause harm if we take them off prematurely. So trust me when I say we want nothing more than to have those awful shoes off of him, especially so that he can go outside, but we have to be really careful that we don't hurt him worse. If you look at him from behind, you can see how severe the atrophy of these muscles are, and this is all kind of older rein rut that's coming off, but his tail kind of curves like this, and he's not able to hold it straight. Even if you try to provide traction, the tail doesn't straighten. And what we found when we took radiographs is that there's really severe osteophyte formation and bad arthritis in between those vertebrae. Whether those are there because the tail was actually fractured or whether those were there because of years and years of holding the tail at an abnormal angle, we can't say. All we can say is that there's really severe evidence of injury in the tail. And then these big lick horses, they have their tail tendons cut, so you can flip that tail all the way back up here. So that's not normal. A normal horse wouldn't be able to move their tail all the way up. So we also noticed that he's had some ventral edema. Since he arrived, that's kind of waxed and waned, and I don't know if you can see from an angle, but if you look in between his front legs, he's got kind of like loose, droopy skin from where this edema was. Edema just means there's fluid outside where it should be. It's a very non-specific term. It doesn't mean that we know exactly what kind of fluid it is, where it came from, or what the inciting cause was, but he's had it. His sheath is really bad, and I was able to do an exam of his penis, and that itself is not the issue. So we don't know why he's having swelling. And usually it just kind of shows up there because it's dependent. So it kind of travels to wherever the lowest point is. But that is also a concern. And he's just really such a good boy. It's difficult to tell with him because I think he's actually quite dissociated. So he's very cooperative and he's very lovely to work with, but he's also not really present a lot of the time. And especially when we've had him in here for longer periods of time, normally horses kind of shift their weight around and kind of move in areas that are comfortable. And this horse does not move the front part of his body as if he thinks he's not allowed to do it. We do know that the owner of this horse was, I don't know if prosecuted is the right word, but USDA fined him and banned him for soring this horse historically. And what's really heartbreaking is that a lot of these scars are different ages and time. So it doesn't just appear to have happened once or twice. It appears to have happened serially over this horse's career. The practice that is done is usually done using caustic chemicals that cause superficial but local irritation that exaggerate the horse wanting to pick its feet up. And then sometimes they put chains and additional weights around here. And there are some other scars that are more consistent with kind of like an object being around this horse's legs. So poor buddy, he has had a lot done, and he's only 19 years old, which really isn't that old for a horse. I have a 19-year-old, my kids ride him every day. This horse's body was used in such a manner that it was not sustainable for his musculoskeletal system, and it's resulted in some permanent damage, especially to his spine. And that's really heartbreaking for him because he deserves a long retirement. He was one of the top 10 horses in his field at one point with his show career, and he got dumped in a slaughter auction, which was really unfair for him. So he also has multiple other superficial scarred areas on the front of his leg that you can feel really easily. He's got one here, and one here. And then on this leg, he has one here. He has a line of scars here, and then he's got them here and here as well. So if you run your finger over, you can feel these thickened, scarred areas. This is a bit difficult to tell without palpation, but if you look at the angle of this hock, we do have some effusion. See how much my thumb can sink in here? So this is the tarsal joint. So that's quite a bit of effusion or swelling in that joint, but this one is probably twice the size with more heat associated. And if you look at them straight from head on, you can see how much larger and more rotund this one is than this one. They both have arthritis in them radiographically, but soft tissue-wise, this one is much worse than this one. And you can see how much more swollen this whole leg is than this one. We did just rinse his legs off, and we're gonna put some more liniment back on those legs, but this is actually a huge improvement from how they used to look. So we really wish we had a more optimistic outlook on this guy and our ability to keep him comfortable long-term. But he really is in a period of hospice here with us, and he's continuing to decline with his heart disease and his musculoskeletal discomfort and his edema. It is not fair to him for us to continue to push him if his body is indicating that he's not going to respond. This guy was used inappropriately for so many years of his life that he has a lot of issues that we aren't able to fix. And by we, I mean we as veterinarians, even with surgical intervention and that kind of stuff, there's not a good chance that we're going to be able to keep this guy comfortable long term, and it's not fair to him to keep him around just to make us feel better.
This is Chicken Nugget. Chicken Nugget came in last Thursday with his 3 siblings. They were found in a dumpster at McDonald's, hence the name. And over the weekend, one of our girls that came in to feed and clean everybody noticed that he had a little wound on his neck, and she thought it might be a little puncture wound. So this morning, we just kind of shaved it down. All this like bloody color is just from flea dirt, not from the wound. And when we were just looking at it, we noticed that there is a little bug in there. So probably like a little botfly trying to just burrowed in there. And so we're trying to get it out now. Doesn't want to come out right now. So we're gonna give it a little bit and see if it makes its way out, and it's just far enough that we can pull it.
So unsurprisingly, Sergeant Muffins was perfect today for his recheck exam. He got lots of cookies. We got x-rays of his front feet, back and teeth, and he looks fantastic. He has really, really, really mild arthritic changes. So for a 28-year-old, I am thrilled with how he looks. This partially explains why he's such a happy boy. He really has very little arthritis. He does have pretty significantly more teeth, but they all feel really strong. Nothing's mobile, which is great. He has some diastema, which are some gaps between teeth, but the organization that's interested in him has a senior horse pasture, and this guy's gonna need MASH to try to get his body condition back up. He does have elevated blood levels that indicate metabolic disease, but the disease that we believe he has is very treatable. There's a drug called Pergolide that lots and lots of horses take, and actually it's one that we've had a lot of our supporters donate to us because a lot of horses are on it long term. So if you've donated Pergolide, thank you. We use it. It really helps horses like this, and it helps with the expense. We don't have to consider, hey, how much is it gonna cost us? It's about $1 a day for them for life, so it's a pretty low level commitment. So I'm really happy with how he looks today. We're gonna double check his blood work. Our biggest concern with him is his teeth, and he does have a heart murmur, but it sounds just like mitral valve regurg, which is very common in older horses and usually pretty benign, doesn't affect their quality of life. So I'm happy about that. We'll probably pop an ultrasound probe on his heart before we clear him for travel, but overall today I couldn't be happier with how he looks, and he's gonna go back outside.
Okay, Mari, what's going on?
So we have an adopter here, and we're super excited that he is adopting Ruby. Yay. So she is going to be leaving with an amazing adopter, Ricky, right over here.
Hi.
Hello.
You want to talk a little bit about yourself?
I caught a stray dog that I couldn't keep because it got into my chickens, so I had to catch him and bring him here, but I found Ruby. She's a Beagle mix, and I think she's going to make a great addition to our family.
And she'll be spoiled, like you are already. Come on, baby, let's go home. Let's go home, Ruby.
I've always loved Beagles. I've never owned a Beagle. Of course, I know she's not a full Beagle, but she's a good dog. I just like their temperament.
Perfect.
We have lots of grandchildren and neighbor kids that come around, and I don't want an aggressive dog.
We're very happy that she's finding a home because she's been with us for a good bit.
It's okay. I hope she never looks for another one.
Yeah.
We got Ruby maybe a month and a half to 2 months ago. She came in with Copper. Megan from High Forest grabbed them. They were dumped at Crazy Horse, which is a river down here that people like to go kayaking and canoeing on and stuff like that. So Megan brought her and Copper to us. Copper found a home later on the following week. He actually went to Arizona. And Ruby's been here. We've advertised her. She's just had no luck finding a home until today. She's been just perfect little thing. She hardly makes a peep. But we love her, and we're so glad she's finally finding a home because she's just the sweetest little thing.
Let's go.
Woohoo!
You have a home.
Can't wait.
Oh, Ruby!
I know.
Oh, that's perfect. Oh, you're such a good girl.
The vet team wanted to give you guys one more update on this boy. We've decided to let him go. We haven't been able to control his pain well. It's really tough in these cases where they deserve so much more. I feel like this every time we have a draft horse that comes in, but I wanted to make sure that everybody understood that it's not just his feet. In fact, while his feet are in really bad shape, they're really not even remotely the most concerning thing that we found with this horse. His heart murmur is a grade 5 out of 6, and Dr. Gina's ultrasound findings on his heart are very severe. He has a lot of regurg, so his cardiac disease is advanced. His musculoskeletal disease is advanced, and his back is extremely painful. He's very, very stoic. He hides it well. But even with daily pain medication and with daily veterinary assessment, he's laying down a lot. He's having difficulty getting back up after he lies down. I did a ton of research. I looked into tendon support boots and soft ride boots and all kinds of things that we could do to help his feet. But the reality is I can't fix his spine where he has a vertebrae touching, and I can't fix his heart. And he deserves so much more and so much longer, but what we can do for him is to let him pass with comfort and dignity and lots of treats. So we're really sorry it's not the outcome that we wanted. We really gave it everything we could, but it's not fair to him to ask him to keep going because it makes us feel better.
We've taken horses off the stacks before, but his body is literally falling apart. And it's so horrific that these horses are tortured for years in their stacks and then literally just thrown away into the slaughter pipeline because they don't want people to see them. It's just wrong and it's heartbreaking. And before we went protesting where we got attacked, I came in here and I just loved on him, and I'm like, this is why I do what I do, is for horses like him. And we'll just make sure he gets lots of cookies because he deserves it. I mean, do the right thing. No matter what you are doing to your animals, like, do the right thing for them. I'm glad that he was able to come here and at least spend some days pain-free under medication and stuff. I wish we could have taken the stacks off, but it would have caused him more discomfort. And it would have made us feel better, but it would have caused him more discomfort, so. Sorry, buddy. I wish there was more we could do. I know.